All right. So, next one. Hopefully, you learned a lot from placenta previa. The next one we're going to talk about is low birth weight. Low birth weight is when the weight of the fetus is under 5.5 pounds. Low birth weight is most often caused by premature birth. Now, I'm going to tell you it is not always caused by premature birth. So I was technically a low birth weight baby. I was 4.5 pounds when I was born, but I was not a premature baby. So I was not born super early. I just was a very tiny baby. Okay. So low birth weight is under 5.5 pounds. Then we have premature birth, right? That goes along with it. This is when the baby is born before 37 weeks. So this is when a baby is born more than 3 weeks early because pregnancy usually lasts about 40 weeks. Premature birth often leads to low oxygen, trouble staying warm, trouble feeding and gaining weight, and breathing problems. Okay? Usually they have breathing problems because our lungs are one of the last things, to develop before the baby is born. Okay? So, I'm going to show you, this is one of my friend's babies. This is Denver. Denver was born at 26 weeks. He weighed 2 pounds 4 ounces, so he was premature and a low birth weight baby. Okay, so this is him when he was very young. This is him when he was 10 weeks old. He was in the NICU for 100 days, and then he graduated. And then this is him when he's 4 years old. Okay, so preemie babies are they are more likely to live now. If you were to ask somebody like years ago, not all preemie babies live, and not all of them live still, but they have a much higher chance of succeeding and living now than they did even just a few years ago. Okay. All right. So the next thing that can go wrong is a miscarriage. This is the spontaneous loss of a pregnancy before the 20th week, so the 5th month. So this is 20 weeks. This means that the baby dies before 20 weeks. About 10 to 20% of known pregnancies end in miscarriage. So this is relatively common, but it's not an easy experience. So it says known pregnancies, so that's like females who knew that they were pregnant. About 10 to 20% of those pregnancies end in miscarriage, which is really sad, right? Most miscarriages happen because the fetus is not developing normally. So a lot of miscarriages happen because it's not developing normally. Some of them happen for other reasons, but that's the most common reason it happens. All right, and then we have a stillbirth. This is the birth of an infant that has died in the womb after having survived through at least the first 20 weeks of pregnancy. So 20 weeks is kind of our mark. If the baby dies before 20 weeks, it's called a miscarriage. If the baby dies after 20 weeks but before they're born, it's called a stillbirth because they're born still. They're not alive. So miscarriage, usually mom's body gets rid of the baby on its own. Sometimes mom has to go in for a procedure where they kind of clean up the uterus and make sure that everything came out after the miscarriage. But with a stillbirth, mom usually ends up having to give birth to the baby, which is really sad. Whether that's a vaginal birth or a C-section, mom has to give birth to the baby, which can be very hard because the baby is not alive still, right? So, those are some complications of pregnancy. All right. So, that's your notes. So, then you're going to follow along with your other packet your paper that I gave you, go to the next thing that you should be doing for this section. Okay?